I'm Cassandra and I'm an athletic therapist at MOVATI Athletic. I take on a very functional approach to assessments. I like to look at full body movements and then go more specifically into joint based. Because a lot of times there's a lot of compensations that happen outside the joint where the pain is that can actually cause that pain. So I like to see how our body's moving all together and then more specifically into where the pain is at. Common injuries in the gym are a lot of shoulder pain, a lot of knee pain, a lot of low back pain. Some common injuries in a gym environment: shoulder pain, low back pain, knee pain. How we commonly address it is an assessment, look at specifically the shoulder, because most of the time we're trying to figure out, okay, is this a compensation? Where is this pain coming from? Most of the time it doesn't come from a specific injury, so that's where we're trying to see. Is it an injury base? Is it a compensation base, faulty movement base? See if it's more stability, mobility type thing that needs to be added into their programming to help relieve pain, and then we go from there. I collaborate with my coworkers on a one-on-one way. I go and assess their clients. A lot of times the coaches are in the room with me so they can see the assessment and we can talk through exactly what's happening as we test the client through functional testing. Then I go in with the client, with the coach itself to work through what they should be doing on a daily basis for mobility, for stability. And then additionally, I work with the coach one-on-one. We have a really good open communication of what changes need to be made to their actual programming, if any, or what they should include, what they should look out for additional compensations, or what they should avoid depending on the injury. How I work with athletes and members at the gym to help with their injury recovery and promoting good benefits from the injury is very one-on-one basis. We take them through soft tissue release, hand-on skills, whether it's joint mobilization, whether it's actually soft tissue work to help promote recovery. And then I work on giving them daily little stability, mobility exercises that they need to incorporate into their routine. And then I work with them specialized to go through their actual program to be okay, what needs to change? Most time, not a lot needs to change. Or to be let's add in these exercises, let's add in these activations. A challenging case I've had to work with is a lot of the times diffuse pain. This diffuse pain doesn't really come from anything specific, just came on one day, it's really painful, and then going through testing and everything, it might be hard to figure out what exactly is. Nothing's really coming up positive, nothing's really coming up negative. Sometimes that happens a lot with low backs. Sometimes it can happen with necks. So with that, we refer out. If it's something that I can't figure out or is past my scope, we'll refer out either for imaging, either to get them with a different practitioner. And then I work on closely one-on-one with the practitioner to help in the gym environment to help get them back to working out, help reduce their pain, help improve mobility. Anyone can book an athletic therapy session. It doesn't have to be someone that's doing one-on-one training. It can be anyone at all.